Hey guys, I'm Vernon and I'm with,
Dr. Buleni, hi.
as usual. So today's gonna be an interesting recording because I'm basically gonna ask her in person all the questions that you probably had, right? All the questions that any patient would ask a doctor, right? So, not to waste any of your time, I'm gonna get straight to it. The first question is, why does the dentist always know when I haven't been flossing?
We know. We definitely know. We can see. I can see even in a restaurant, or whenever I meet someone like, this one doesn't floss. No, okay. We can see because we can see the biofilm of the plug, and we can see also the calculus as well. And sometimes your breath just tells it. You're like, oh my God, wow. Okay. Yeah.
Is that the reason? Okay, and then question two, does everyone lie about how often they brush?
Yes, all the time.
All the time, right?
Yeah.
Okay, the third question, why is dental treatment so expensive? And like, I just want to add on to it because it is kind of true because I can go to a doctor, like a medical GP, and then I'd pay maybe 600 for a consultation. But when you go to Smilez Dental Surgery for a consultation, roughly you'll pay around 900 or 1000, right? So even just for a consultation is more expensive. Why is that?
Okay, let's go back to your medical doctor. He'll probably have this chair, like two of them, and the table, the counter. Just estimate the price for that. So on my side, I have to buy the dental chair. The dental chair on its own is minimum 250K. And on its own, it doesn't work. I still need to buy the compressor. I still need to buy the suction as well. So that's why it gets to be expensive. On top of that, with a medical doctor, you can sit like this without him wearing PPE. I still need to pay to wear PPE, which is expensive. And then I have to take the radiographs, which the machines are expensive. If I, for an example, I'll just go further. If I were to do a crown, I have to pay the lab for the crown. 40 to 70% of that money goes to the lab. It's not my money. I use material to take the measurements, the impressions for your crowns. I do the entire thing, the planning and everything. For the implants, I need to buy the implant. I need to buy the implant placing machine, and obviously all the other things related to it. So the components of it, it's mostly the equipment that we buy. Dentistry, just to practice dentistry, is very expensive. Just for you to open up your room, currently you'll need a minimum of 1 million to open up your practice.
Wow.
Just a minimum, because the dental chair minimum 250. The intraoral radiographs minimum roughly plus minus 60 grand, just so for me to be able to use a sensor to do those small X-rays. If I want to take the big X-rays, the PanServ, they are from 670 or 700,000 just to get the pen and self. Then if it includes the CBCT, it's roughly 1.3 million. Those are the basic prices. So I have not bought the instruments I'm using for your teeth. I have not bought the autoclave to make sure that I sterilize my instruments properly. The electricity that I'm using to sterilize those instruments, the PPE. Then I have to buy the dental material. There is no company that produces dental materials in South Africa. They're all imported. So when the oil prices go up or the fuel prices go up, also our dental material goes up as well,
Like
which
now.
like right now. So you might find that the prices increase in January, and now the dentists also increase their prices now, because obviously they have to increase their prices because their materials are more expensive now, and sometimes because of the shipping and with the flights that have not been flying for us for a while, then there's a backlog of stock, so we had to wait for that, because none of the only thing that are being produced in South Africa mostly is just the gloves and the mask.
Wow.
So you're telling me you need to do an implant. I need to order it in Germany. but through the dental companies that sell those things, even the dental material for doing a restoration, you know. So, and even doing the crowns. Yes, at the practice, we decided to buy the machine where we can be able to do your same damn crowns. But still, we need to order in a company, a German company that orders from Germany for us to have to do that. So I still need to pay for those components of that machine as well, and also the crown material as well, and the designing of the crown, just to make sure that it's a good design and it fits as well. Yeah, so basically dentistry, to practice it is expensive, to study it is expensive, to keep it working it is expensive, because we have to, there's new technologies that are coming in, we have to keep up, what's the,
Yeah.
no, to keep abroad, to keep, we just have to keep up
Yeah,
with,
to keep up.
yeah, we just have to keep up with the latest things that are going on, you know.
Adapt,
Yeah, we have to adapt. Otherwise, if I was still using the old equipment that I started with, I mean, it takes me time, and obviously it's uncomfortable for patients. The more the technology improves, the more it's better also for the patients as well. And we strive to give you the best treatment as doctors. And obviously, if we're giving you the best, that means we also operate better, we prevent back ache injuries, and because we know as dentists we're always handshake, so the better the equipment, the better it is for our health, also for your health, and also for the treatment that you are receiving as a patient. So dentistry on its own is just expensive, and it's expensive. And I think we are the most healthcare that use the digital products that are out there, the computers, the digital scan, the digital crowns. You know, we are, and I think we used AI before AI was used, like honestly, because yeah, we used it to, especially with the designs of the crowns, we would scan the tooth, and the AI will just give us the design, and then from there, obviously, we have to maneuver it into a way, because remember, it's intelligence. We are the real intelligence. We still need to give it some direction. So we've used AI before AI was famous. So yeah, I guess it's not really expensive. It is expensive in general in terms of the the equipment that we use. Yeah, so it's quite different. I think I'm repeating myself.
Okay, anyway, but in terms of equipment, I definitely agree, because, guys, if you go into a practice, it looks like an office for Iron Man. It's like all these fancy equipment everywhere. It's like, she's part of the Avengers. So the next question is, we know that smoking and drinking alcohol is bad for your teeth, right? Also, like drinking sodas and all of that, like all of that is bad, right? But I'm sure there's a lot of people right now who are watching this and they vape a lot, and they're like, what's wrong with vaping? I don't even get high from vaping. It's just white. It's not like, it's any color. So how is vaping bad for your dental health?
Um, I think, okay, vaping for people, they say it's cool. So I say vaping is cool for certain people. The only thing that makes it not cool or bad is the chemical that you are putting in your body, because you are introducing all these chemicals, the banned chemicals, into your lungs, and you want your body to now process all of this, and some of these chemicals the body cannot really process, and they stay in your body as foreign bodies, because that's what the body recognizes it. And sometimes it's difficult for the body to get rid of, and the body fights them, and when it fights them, that's when you find yourself with the cancers and with the what's this, the upper respiratory issues. Some people, they lose their voices, they have oral cancer, they have throat cancers, they have lung cancers, because of the chemicals. It's more than anything, it's just the chemical composition that is inside your vaping material.
Oh, okay. And then for the second last question, um, is how often can someone like do a teeth whitening procedure or treatment? Like, do you recommend it to everybody? And if someone is always obsessed with having white teeth and all of that, like how often would you say they can do it?
I would say, for an example, if your teeth are really, really yellow, there is a program that I put you in, whereby I'll do the whitening, give you a day off, and then we'll alternate the days, up to 3 sessions or 3 visits, and then later on I give you the take-home kit for 7 days. After that, please wait for 6 months again for you to be able to do the second session of the teeth whitening, to allow your enamel oxygen to normalize again. But should you then be the person who buy these over the counters and you use them every single day, you dehydrate your enamel, it cracks, and then your teeth becomes brittle and they break. So use with caution. Always visit your dentist, or always follow your dentist advice, because what I'm saying now is a general advice, but based on what I see when I see you, the diagnosis, based on who you are, the medication you're taking, it's always going to be different.
And then the last question, which is a follow-up, right? So we know veneers, and they're trendy right now, and everybody's obsessed with them, and it's mostly because it makes their teeth look white and perfect. But would you, as a doctor, would you recommend it? And like, are you like, wouldn't you be against it, since people will then now not care about their real dental health, which can affect their heart, their health in many other ways, and then hiding that bad dental health with basically veneers that look perfect on the outside for other people when they actually have the worst dental health ever?
You've just touched on a sensitive topic. Have you heard people say you've got a veneer breath?
Nah, that's the first time I heard that.
There's something that is called a veneer breath. That is similar to a mouth that has not been taken care of. When I say I can tell by the mouth odor before I can tell that you're brushing regularly. So what happens is people feel that now that because their entire tooth is covered by these veneers or crowns and their teeth are white, then they omit the brushing, because the veneers mostly they are ceramic, it's mostly their glass, so they don't stain that much and they feel smooth and clean, and they don't see the need of brushing anymore, and the gums suffer. There's that area between the tooth and the gum where you still need to floss and brush your teeth. What you'll find is that people with veneers or smile makeovers or the crowns, they tend to just put a mouthwash, or they don't floss, or they feel that because their teeth are white, there's really no need for them to then take care of their teeth or brush them regularly. So then they end up having the veneer breath. Yeah. So I would say that people need to make sure that even if you've gotten a crown, still take care of the crown or the veneers. You still need to floss. Remember, the veneer is on your natural tooth. And there's that part where the tooth attached to the bone, and there's a part where there's a gum attaching to the tooth. There's still your natural tooth structure there. And because people are not brushing or flossing their teeth properly, you'll find that dental caries starts to develop underneath there. And it's subtle because you can't see it. It's covered by your gum, but it's the natural tooth structure. And you'll be like, but I have veneers. Or why are my teeth getting rotten again? Why am I having cavities again? That is because you covered your tooth, obviously, with the veneer, but you still have your natural tooth underneath, which you still need to take care of. So you can't have veneers and not take care of your teeth, and you cannot bypass taking care of your teeth because you're saying, I've got perfect teeth, they're white, they don't stain, they're straight. There's no point. I'm not taking care of my teeth, therefore, because of that. That's when you really have to take care of your teeth, because you've got these artificial things on your natural tooth, so it needs extra care than your natural tooth. Did I answer your question?
Yeah, you did. You just added on further. But yeah, the question was just that, um, like, is it advisable to have veneers since, people can use it to cover up their bed?
Oh, okay, yeah.
Yeah.
It's advisable to get veneers if your dentist advises you to. Um, for an example, if you had like rampant caries, all your teeth were rotten, and obviously you had multiple restorations that keep on failing, then go for the veneers and the crowns. But don't go for the veneers and the crowns because you don't want to brush your teeth ever again, or whatever reasons. Because I know some people will be like, I don't want to do braces, I'd rather do veneers. I would not advise for you to do that. If your dentist suggests that you do veneer, you do orthodontic treatment, please go for that and preserve your teeth, and you rather do whitening and have your naturally white teeth. That is better in the long run.
Okay, so you guys heard it from the doctor herself, and we hope you take care of your dental health. And we hope you also educated yourself through this as we strive to just do that. That's literally what we're doing. Honestly, we're not getting paid for this. So the least we ask from you is to please subscribe, comment, and like the video. Share it with people who you think are hiding their breath or dental health with veneers type of thing. So yeah, don't be stingy with the video, yeah, because this is a gold mine and you heard it from the doctor herself. So thank you so much and see you on the next video.